The blood hit the floor before anyone called a code. One elderly veteran was turning gray in room 14, while the surgeon on duty was busy laughing at a nurse's suggestion that something was wrong. Outside, 3 military helicopters were already cutting through the Colorado sky, dropping fast, rotors screaming over the mountain ridge. Nobody inside Hartwell Memorial Hospital knew what was coming. Nobody inside had any idea that the quietest woman on the floor, the temp nurse everyone mocked, the blonde who refilled IV bags and said nothing when she was talked over, had once kept men alive in places where hospitals didn't exist. That calm was about to end, and the people who'd spent months treating her like furniture were about to find out exactly who they'd been disrespecting. If this story is hitting different already, follow me, hit that like button, and drop your city in the comments. I want to see how far this story travels. The morning shift at Hartwell Memorial Hospital in Delverton, Colorado started the way it always did, with someone talking over someone else. "Donovan, you're on float again." Charge nurse Patricia Well didn't look up from her clipboard when she said it. She never did. "Ortho needs coverage on 4, and if Dr. Salter asks, you were never assigned to his patients. He specifically requested Kessler." Mara Donovan pulled her badge lanyard straight and said nothing. That was the 3rd straight week on float. No primary assignment, no continuity of care, no real reason except that float nurses were easier to dismiss when someone more credentialed needed the room cleared. Mara had figured that out during her first month. She'd stopped pushing back around week 3. She picked up the assignment sheet, noted the patients she was covering, and walked toward the elevator without a word. Behind her, 2 of the floor's staff nurses exchanged a look she wasn't supposed to notice. She noticed. Mara Donovan was 37 years old, medium height, with sun-damaged skin that made her look a few years older than she was, and a manner that people almost universally read as mild. She wore her blonde hair pulled back tight. She kept her voice low. She smiled at patients and let administrators talk at her, and she moved through every shift with the kind of deliberate stillness that some people mistook for weakness. She had learned that stillness under much worse circumstances than a hospital float assignment. But she'd made a choice when she left the Navy. Left the work, left the team, left the version of herself that operated under a call sign in places that didn't appear on public maps. And that choice included not explaining herself to people who hadn't earned an explanation. So she floated. She took whatever assignment appeared on the sheet. She did her work, she clocked out, and she drove back to the rented 2-bedroom near the edge of town where the only reminder of what she used to be was a locked footlocker under her bed that she hadn't opened in 4 years. That was the plan. The plan started breaking down around 8:40 in the morning when she walked into room 412 and found Walter Kemps sitting at a 45-degree angle in his bed, working too hard to breathe. "Good morning," Mara said, pulling the door shut behind her. She moved to his bedside, eyes already running the room. The oxygen flow rate, the IV drip, the monitor readings on the wall. "I'm Mara. I'll be covering you this morning. Can you tell me how you're feeling?" Walter was 71, a former Army artilleryman who'd spent 3 tours in places that had left his lungs scarred and his hands permanently calloused. He had a kind face and a flat affect that came from decades of controlling his expression in front of people he didn't trust yet. He looked at Mara the way experienced patients look at float nurses, assessing whether she was worth the energy. "Pressure," he said. "In here." He touched his sternum. "Started about an hour ago," told the other nurse. She wrote it down. Mara checked his chart. Nothing had been flagged. She put her hand to his wrist, counted his pulse. Then she pulled out her penlight and checked his eyes, tilted his chin and looked at the color in his nail beds. His jugular veins were distended. His oxygen sat had dropped 2 points in the last hour according to the monitor, which would have been easy to miss if you weren't specifically looking for the trend. She was specifically looking. "Has anyone listened to your chest this morning?" The PA did a quick check at 7. "What did she say?" "Said I sounded fine." He paused. "She was in the room for maybe 90 seconds. Mara pressed her stethoscope to his back and listened. The difference between what she heard and what fine sounded like was not subtle if you knew what you were listening for. She kept her face neutral while she processed it. "I'm going to get someone to look at you," she said. "Stay as still and calm as you can." She left the room at a pace that was fast enough to cover ground quickly and slow enough not to alarm anyone in the hallway. The two calculations were ones she'd been making since she was 24 years old, in situations where getting them wrong had real consequences. She found Dr. Adrian Moss at the nursing station, mid-50s, second-tier attending, the kind of doctor who was competent but cautious and who deferred upward whenever he had any doubt. He was reviewing lab results with his glasses pushed up on his head. "Dr. Moss, room 412, Kemps. I think we're looking at a pleural effusion, possibly tension. He's showing distension in the JVP, his satity's been trending down, and his breath sounds on the left side are significantly reduced." Moss blinked at her. "Who are you?" "Float nurse, covering 4. The patient specifically told me he's had pressure and shortness of breath for the last hour, and it wasn't flagged." Moss looked at his chart, then looked at her, then looked at the chart again. "I'll go take a look. Sooner is better." He looked at her again, a quick recalibration look that people gave her sometimes, trying to figure out if she was overstepping or actually right. And then he said, "I'll go in 2 minutes." It was Dr. Garrett Wolfe who came by instead. Wolfe was the one they always mentioned in the same breath as the hospital's reputation. Chief of surgery, head of the trauma program, the face on the website's front page. He was 52, had a jaw that looked engineered for giving television interviews, and he moved through the hospital the way men who have never once been asked to justify their presence tend to move, like the hallway existed specifically for them. He didn't introduce himself to Mara when he approached the nurses' station. He addressed Moss. "What's the issue on 4? Moss said, "Float nurse has a concern about one of the vets, room 412. Wolfe turned and looked at Mara the way he might look at a piece of hospital equipment that had unexpectedly started making noise. "What's the concern?" Mr. Kemps, 71-year-old male, admitted for monitoring post-procedure. He's presenting with chest pressure, reduced breath sounds on the left, jugular distension. SAT's been dropping. I think he needs imaging at minimum, possibly urgent intervention. Wolfe listened to this with the expression of a man sitting through a presentation he wasn't asked to attend. When she finished, he said, "Have you reviewed his chart?" "Yes." "And his overnight notes?" "I have. Nothing was flagged but the trend in his oxygen saturation. Float nurses don't trend. That's not your assignment." He said it in the flat, instructional tone of a man who is used to having things explained once and not repeated. "You cover, you report, you don't diagnose." If Moss already looked at this patient and cleared him, that's the medical judgment that stands. He looked at Moss. "Did you look at him?" Moss said, "I was about to look at him, write a note, and..." He looked back at Mara and his voice went a half-degree colder. "Stay in your assignment. That's what you're paid to do." He walked away. Mara stood at the nursing station and did not say anything else. She went back to room 412. Walter Kemps looked at her when she came in and read her face the way experienced patients read nurses' faces, looking for information in the thing being controlled. "No luck?" "Someone's going to come see you," she said. "You don't look convinced." "I'm going to keep checking on you." She adjusted his oxygen flow. "Tell me the second anything changes." He watched her and said quietly, "You've done this before. Not here, somewhere else." "I cover a lot of floors." "That's not what I meant." She didn't answer him. She took his blood pressure. It had shifted slightly in the wrong direction. And she wrote everything down and she went back out into the hallway and she started working through every channel available to her. She flagged the charge nurse, Patricia Weld, who listened with half her attention and told her that Dr. Wolfe had already noted the case. She flagged the patient advocate line, which went to a voicemail. She left a message in the patient's electronic chart, a formal nursing note, timed and logged, with every clinical finding spelled out. Then she went back to the room and sat down in the chair beside Walter Kemps and kept watching. It was Mara who recognized the exact moment things began to accelerate. His blood pressure dropped a measurable point. His breathing changed, more labored, the work visible in his neck muscles now. She had a pulse oximeter on his finger, and she watched the numbers with the specific quality of attention that people develop when they have watched numbers like these in conditions where the margin for error was measured in seconds, not minutes. "Something's wrong," Walter said. He wasn't panicking. He was reporting. "I know," she said. "I'm getting help." She went to the doorway and said clearly down the hallway, I need someone in 412 right now. What happened next at Hartwell Memorial? The argument that broke out at the nurses' station, the way 3 different people deferred to each other instead of acting, the fact that 7 minutes passed before anyone with authority moved toward the room was not unusual. It was exactly the kind of institutional failure that happens in places where hierarchy matters more than outcome, where the chain of command is treated as a fact of nature rather than a tool that can be wrong. Dr. Moss finally appeared with a portable ultrasound unit. He did the scan with Mara standing at the foot of the bed, and what he saw on the screen made his face change. "That's a significant effusion," he said quietly. "Yes," said Mara. "How long has he been like this?" "At least 90 minutes that I know of, probably longer." Moss looked at her and then looked at the screen, and then looked at his patient. And to his credit, he stopped deferring. He picked up his phone and called for a rapid response team, and he did it in the direct, no-argument tone that he could produce when he wasn't trying to calculate social risk first. The rapid response team arrived. The room filled up. Walter Kemp's was moved to acute care within 12 minutes, and the procedure he needed, the one Mara had been gesturing toward for the better part of 2 hours, was performed that afternoon by an interventional team that wasn't Wolf's. He was stable by 3 o'clock. Nobody came to tell Mara this. She found out by checking the patient status board the way she'd been checking it between assignments all afternoon. She was pulling meds from the Pyxis unit near the east elevator when Patricia Weld found her. "Dr. Wolf wants to speak with you," Patricia said. The way she said it was not the way you announce good news. Wolf's office was on the 4th floor, corner position, the kind of office that said something about institutional priority. He was behind his desk when Mara entered, and he was not alone. There was a woman Mara didn't recognize seated off to one side. Administrative, the posture said, and the name badge read VP of Clinical Operations. "Close the door," Wolf said. Mara closed the door. "This morning," he said, "room 412. You went around my clinical assessment and you created a protocol issue with your conduct at the nursing station. I documented a concern about a patient's deteriorating condition. After I had already reviewed the case. You hadn't reviewed him directly. You had reviewed what was in the chart." The VP shifted in her chair. Wolf let a moment pass. "You flagged the patient advocate line," he said. "You made 4 separate entries in the chart in a 2-hour window. You created an atmosphere at the nurses' station that upset the staff. The patient was deteriorating. That is a medical determination, and you are not qualified to make it. I'm qualified to report clinical observations, which I did. You're a float nurse," Wolf said. "You cover gaps. You don't run independent assessments on patients that have been seen by an attending physician. And when a chief of surgery tells you to stay in your lane, you stay in your lane." He opened a folder on his desk. "We're terminating your float contract effective end of shift today. The staffing agency will be notified." The room was quiet. "Mr. Kemp's is stable," Mara said. "I'm aware of that." "Because the intervention happened. Because Dr. Moss ordered imaging at his own discretion. I flagged it for Dr. Moss." Wolf looked at her. "You're terminated, Ms. Donovan. Leave your badge at the nursing station when you clock out." Mara looked at him for a moment. Then she looked at the VP, who was studying the middle distance with the careful expression of someone who had already made up her mind about something and didn't want to be drawn into defending it. She stood up. "I'll leave the badge," she said. She walked out of the office, walked to the elevator, wrote it down to the floor, and went back to finish her shift. Because Walter Kemp's was stable, but the 3 other patients on her assignment still needed coverage, and she was not the kind of person who left work unfinished because her own situation had changed. She worked the next 3 hours in silence. At 5 o'clock, she handed off her remaining patients, documented her final notes with the same clinical precision she'd used all day, and walked to the nursing station to drop her badge. Patricia Weld was there, and she watched Mara set the badge on the counter, and she said, almost quietly enough to be kind, "Sorry it worked out this way." Mara picked up her bag. "Is Walter Kemp's in acute care 4? "Yes, but visiting hours, and I'm not visiting. I just want to make sure the handoff notes are complete." She walked to acute care 4, checked the notes on Walter's case, and confirmed that everything was documented correctly. His room was dim, the late afternoon light coming in sideways through the window. He was asleep, his breathing even now, the monitors reading steady. She stood in the doorway for a moment and looked at him the way she sometimes looked at patients, with the specific private recognition of someone who had fought for a stranger's life and would never be thanked for it, and who had made peace with that a long time ago. Then she turned and walked toward the exit. She was halfway across the lobby when the windows began to shake. At first it was just a vibration, subtle, the kind of building tremor that could be a heavy truck outside or HVAC equipment cycling on. But Mara's body registered it before her conscious mind did, and her pace slowed. Then the sound came. Rotors. Multiple rotors, close, descending fast. She stopped walking. Through the wide glass panels of the lobby's east wall, she could see the access road that ran along the side of the building, and above it, dropping below the ridgeline of the mountains, she could see the silhouettes. 3 of them. Dark and fast, the kind of aircraft that civilian helicopter services didn't operate. They were moving with the purposeful, coordinated precision of units that flew together regularly. The lobby staff noticed. A security guard stood up from behind his desk. A woman at the information counter walked toward the glass. Mara did not move toward the glass. She stood in the center of the lobby with her bag on her shoulder, and she watched the helicopters descend toward the hospital's landing zone. And something in her chest went still and cold in the way that very few things could make her go still. Not from fear exactly, but from the specific recognition of something she had been very deliberately not thinking about for 4 years. The first helicopter touched down. The side door opened before it fully settled, and a figure dropped out. Tactical gear, no unit insignia visible from this distance, moving with the kind of trained efficiency that meant the word military even if it didn't say it. Then another. Then 3 more. Then a figure who moved differently than the others. Not slower. Differently. The kind of calm that came from being in charge of the people around you for long enough that urgency didn't change your gait. He was tall, dark-haired, wearing no rank on anything she could see, which meant he was either very low or very high. She knew which one it was. She knew the walk. She took 1 step back toward the elevators, stopped herself, stood still. In the lobby, one of the security guards moved toward the entrance with his hand already up, starting the standard protocol for unexpected arrivals. The man from the helicopter walked past him without looking at him. Not rudely, just with the complete and total absence of attention that people gave to things that were not their current concern. He stopped in the center of the lobby. He looked around the space, calmly, quickly, the way someone looks at a room when they are searching for one specific thing and they know approximately where it should be. His eyes landed on Mara. She didn't move. He said 1 word. He said it at a volume that was not loud, but that cut through the ambient noise of the lobby. The PA system, the security guard's radio, the hum of the HVAC, all of it, with a clarity that made several people turn to look. Valkyrie. The lobby seemed to contract slightly. Mara felt her pulse shift. Not spike, just shift, the way it used to shift in the seconds before something she'd trained for stopped being theoretical and became real. She had not heard that name in 4 years. She had believed, with reasonable confidence, that she would never hear it again. The man in tactical gear was still watching her. He was waiting with the patience of someone who had no doubt she was going to respond, only waiting to see how long it took. Around her, the lobby had gone into the particular kind of confusion that happens when people can see that something significant is occurring but cannot determine the rules of the situation. The security guard had stopped moving. The woman at the information counter had her phone in her hand and wasn't using it. 2 nurses who had come down from upper floors to see what the helicopters were had stopped in the stairwell doorway. From somewhere upstairs came the sound of rapid movement, boots on tile, the distinctive sound of more people arriving. Mara exhaled once, and then she turned back toward the elevator. Not running, not panicking. Moving with the flat, focused intent of someone who has just made a decision, and the decision was this. If Commander Deacon Holt had landed 3 helicopters at the hospital where she'd spent the last 5 months trying to be invisible, then whatever he'd brought with him was not the kind of situation she had the option of walking away from. She'd walked away from a lot of things. She had walked away from the work, the team, the identity, the call sign. She had built something quiet and small and sustainable in the civilian world, and she had been, if not happy, functional. But she had never walked away from a person who needed her. She couldn't start now. She pressed the elevator button and the doors opened and she stepped inside, and as the doors closed she caught one last look at Deacon Holt standing in the lobby, watching her go. He was already reaching for his radio. And above her, somewhere on the floor she was rising toward, someone was in serious trouble. And the machines that were supposed to be keeping them alive were the only thing standing between her and every answer to every question she hadn't let herself ask since the day she resigned her commission and disappeared. The elevator ascended. Mara Donovan rolled her shoulders once, set her jaw, and let the stillness settle into place. Not the stillness of someone who had given up, but the stillness of someone who was getting ready. The floor indicator climbed. 3, 4, 5. The elevator stopped on 6. The doors opened. The hallway smelled like antiseptic and controlled panic. And at the far end, past the nursing station where 2 staff members were standing frozen, a door stood open with light spilling out, and the sound of an alarm she recognized. Not a cardiac alarm, not a respiratory alarm, but the specific sound of a monitor registering a drop that the automated systems hadn't been designed to catch fast enough. She was already moving. She was already moving. The hallway on 6 had that particular late shift quality. Lights at 3/4, the nursing station down to skeleton coverage. The kind of quiet that wasn't peaceful, but was just the absence of the day's noise. It broke apart the moment Mara stepped out of the elevator. 2 staff nurses were pressed against the wall outside the open room, not from cowardice exactly, but from the specific paralysis that hits people when something exceeds their training. One of them, young, maybe 24, with the look of someone who had been a nurse for less than a year, turned toward Mara with visible relief at the appearance of another adult. "We don't know what's happening. The patient came in an hour ago. The attending hasn't responded to the page." "What room?" Mara said. 614. "But you're not on this floor." Mara walked past her. The room was dim, which was wrong. Someone had lowered the overheads, probably trying to keep the patient calm, without understanding that dim light in a room where a person was deteriorating made it harder to see the things you needed to see. Mara reached up and hit the full lights as she came through the door, and the room jumped into sharp relief. The patient was a man, early 40s, large frame, built like someone who had spent serious time on physical conditioning and hadn't entirely lost it. He was on his back, oxygen mask in place, one arm hooked to an IV that was running something Mara clocked in half a second. Wrong rate for his presentation. Too slow. His color was bad. The particular gray underneath the skin bad that meant the body was making internal decisions about where to send its remaining resources. And the peripheral stuff was losing. The monitor was alarming softly. Not a crash alarm. A sustained low-grade warning that systems were declining across multiple parameters. The kind of alarm that was easy to silence and difficult to understand without clinical context. There was a man in the corner of the room who was not hospital staff. He was in his 30s, wearing tactical pants and a plain dark jacket, and he was watching the patient with the coiled, useless tension of someone whose entire skill set was irrelevant to the current problem. He looked at Mara when she came in. His hand moved slightly toward his side before he registered that she was wearing scrubs. "Who are you?" he said. "Nurse. Who are you?" "I'm with him." "Then get out of my way." She moved to the bedside and started working through the assessment the way she'd been trained to work through it. Not the civilian nursing school version, which was thorough and methodical and took time she frequently didn't have, but the field version, which was fast and brutal and prioritized the things that would kill someone in the next 3 minutes over the things that would kill them in the next 3 hours. Airway, compromised but not closed, the oxygen mask was helping. Breathing, uneven, the left side lagging. Circulation. The pulse in his wrist was present but weak and fast. The blood pressure reading on the monitor was low enough to be concerning and trending lower. She pulled back the edge of his gown without asking permission from the man in the corner. There was a dressing on his left side. Recent, field applied from the look of it. The tape job clean and competent, but clearly not done in a hospital. Beneath the dressing, when she lifted it carefully, was a wound that told her several things at once. The entry and surrounding tissue damage said shrapnel or fragment, not clean surgical. The color of the tissue around it said the infection timeline was very recent, hours, not days. And the drainage said what she'd suspected from the monitor numbers. There was something going on internally that the dressing was only addressing on the surface. "How long has he been like this?" she said. "He was stable 3 hours ago," the man in the corner said. "That's not what I asked." A pause. "The injury happened 14 hours ago." Was he evaluated before he came here? Another pause. Longer. Field evaluation. We stabilized him for transport. Mara replaced the dressing. She moved to the IV, assessed the bag, changed the rate, and then turned to the monitor and started working through the medication list in the chart. There wasn't much. Someone had ordered a basic workup when he came in, but the attending, whoever had been assigned, had either not reviewed the results or had reviewed them without understanding what they were looking at. He needs imaging, and he needs a surgical consult, and he needs a different IV order, she said. I'm going to go get someone. Wait. The man in the corner moved away from the wall. Who else is here? Who's in charge? Of the hospital, right now, at this hour? The attending on duty. I don't know who that is yet. Is there a surgeon? There's always a surgeon on call. Get them. He said it without aggression, flatly, with the directness of someone who is used to giving instructions and having them executed. This patient doesn't wait. I know, Mara said. That's why I'm going. She went to the nursing station and paged the surgical attending on call. The nurse who was covering the floor, a tired-looking man in his 50s named Brett, who had the look of someone 3 hours past the point where he should have taken a break, looked at her with a mixture of confusion and faint irritation. You're not on this floor, he said. I'm aware. I need the surgical on-call, and I need them now. Room 614 has a patient with a penetrating abdominal injury, declining hemodynamics, possible internal hemorrhage. He's been here for an hour, and no one has gotten a surgeon in. Dr. Wolf is not available, Mara said, which was not something she knew for certain, but which she said with enough confidence that Brett didn't question it. Who else is on the list? Brett pulled up the on-call schedule. Dr. Reyes' second call. Page her. She's going to ask why Wolf isn't. Page her, Brett. He paged her. Mara went back to 614 and kept working, adjusted the oxygen flow, checked the IV site, talked to the patient in the low, even tone she used with people who were scared and trying not to show it. He was conscious, which was better than she'd feared when she walked in. He tracked her with his eyes when she moved around the room. I'm going to ask you some questions, she said. Nod if you can. He nodded. Do you have pain on the left side when you breathe in? A nod. Is it worse than it was an hour ago? A longer pause, then a nod. Okay. She squeezed his hand briefly. Not a gesture she'd planned, just something that happened because he was frightened and trying to be very still, and she knew what it felt like to be very still in a situation you couldn't control. Someone is coming who can help more than I can. Keep breathing steady, in through the nose. He blinked at her. His lips moved. Halt, he said. The oxygen mask made it barely audible. I don't know what that means, she said carefully. Halt, he said again, and then something else she couldn't make out. She adjusted his mask and didn't respond. Behind her, the man in the corner said quietly, He's asking for the commander. The commander is downstairs, Mara said without turning around. He'll be up shortly. She didn't know if that was true. She was working on one thing at a time. Deacon Holt arrived on 6:11 minutes after Mara. She heard him before she saw him, not because he was loud, but because the hallway outside changed quality when he arrived, the way hallways did when someone entered them who expected the space to accommodate them rather than the reverse. She was at the nursing station reviewing the imaging orders when he appeared at her peripheral vision and stopped. She finished writing before she looked up. He looked essentially the same as he had 4 years ago, which was either a compliment to the Navy or evidence of something she didn't want to examine too closely. 44 years old, the same controlled stillness, the same way of taking up exactly the amount of space he needed and no more. He had a thin scar along his jaw that was new. You cut your hair, he said. You landed helicopters at a civilian hospital, she said. That's going to need an explanation. I'll explain. First, your man in 614 needs a surgeon, and I'm waiting on one. So if you need something from me, say it while I work. He fell into step beside her without being asked. That was Holt. He didn't ask permission to follow you. He just made following you seem like the logical choice. Reyes got paged? How do you know about Reyes? I did my research before we landed. Then why land here? She pulled the chart back up on the station tablet. There are trauma centers with higher-level surgical capability 40 minutes from here. 40 minutes is not a number Castillo had, he said, and the name bore the patient's name that landed with a weight that told her he knew this man, not just commanded him. We needed the closest facility with an active OR, and I needed, he stopped. What? A beat. I flagged your registry location 6 weeks ago. When the mission profile started running toward this region, I noted that you were here. Mara set the tablet down. She looked at him. You noted that I was here, she said slowly. I didn't plan to use that information, but when Castillo's condition changed mid-flight, I made a call. You made a call, she said. You called my call sign in the lobby of a hospital where I just got fired. Something moved in his expression. Not quite guilt, but an acknowledgement. I'm aware that the timing is not the right word. No, he said. It's not. They looked at each other for a moment the way people look at each other when there's a conversation that needs to happen, and neither of them is under any illusion that now is the time for it. Is he going to make it? Holt said. He's got a chance, she said. Better chance than he had 40 minutes ago. Dr. Reyes is good. I've seen her work. She paused. He was trying to say your name. I know. He always does that. Holt said it without sentiment, the way you said a fact about someone you'd served alongside long enough to know their patterns. He thinks if he can locate the commander, it means the situation is still manageable. Is it? It's getting there. He looked at her. You went into that room without knowing who was in it. There was a patient. You didn't hesitate. There was a patient, Holt. He almost smiled. It wasn't really a smile, more the ghost of the expression, there and gone. No, he said. There wasn't. There was a critical casualty in a civilian hospital in the middle of a situation you had every reason to walk away from. And you didn't walk away. He paused. You never walked away. I walked away 4 years ago. You relocated, he said. That's different. Dr. Marisol Reyes arrived on 6 at speed, the way surgeons arrived when a page had communicated actual urgency rather than administrative concern. She was small, sharp-faced, somewhere in her mid-40s, with the kind of efficiency of movement that came from operating under sustained time pressure for 2 decades. She went straight to 6:14 without stopping at the station. Mara followed. Reyes did her assessment in under 3 minutes. She didn't speak while she worked, which Mara appreciated. When she was done, she straightened and looked at the chart notes on the tablet, the ones Mara had entered, and she read them carefully before she said anything. Who did this workup? She said. I did, Mara said. Reyes looked at her. Your float? I was. My contract ended today. Whoever ended it made a mistake. She turned back to Castillo. He needs the OR, now. I'm calling it. She looked at the man in the corner. He's going into surgery, and I need the room cleared except for the team. I'm staying, the man said. You're not. With respect, ma'am. None of that sentence is going to end in a way I care about. Reyes pointed at the door. Out. The hallway is 12 feet from here, and I will update you in real time if the situation changes, but you are not in my OR, and you are not in this room. Move. He moved. Reyes had Castillo transferred to pre-op in under 8 minutes. She did it with the clean, organized efficiency of someone who was good at her job and had no patience for anything that slowed it down. Mara helped with the transfer and then stood in the hallway as the pre-op team took over, and she felt the shift. The particular transition when a patient left your hands and entered someone else's, with the same feeling she always felt, which was a mixture of relief and the particular helplessness of not being able to follow them the whole way. Holt was standing near the elevator. He'd watched the transfer without getting in the way. He's in good hands, Mara said, coming to stand near him. Because you were here. Because Reyes is good. Because you were here, he said again, and she didn't argue with him a second time because arguing with Holt about things he'd made up his mind about was a particular kind of exhausting she didn't have the reserves for tonight. The hallway settled into its late shift quiet. Somewhere below them, she could hear the distant echo of the building reacting to the helicopters, voices, movement, the kind of institutional disruption that took hours to fully settle. She thought about Wolf in his office with his folder. She thought about Patricia Weld saying, "It's a shame it worked out this way." She thought about Walter Kemp's breathing steadily in acute care 4. You said you flagged my location 6 weeks ago, she said. Yes. Why? Holt was quiet for a moment, not avoiding the question but treating it with the seriousness it deserved. Because I wanted to know where you were in case you needed me. In case I did, he said, and then quieter. In case you were all right. She looked at him. I'm functioning, she said. I can see that. That's not the same thing as being all right. No, he said. It's not. He looked at her steadily. We need to talk about what comes next, for Castillo and for the rest of it. There are people who are going to want to understand what happened tonight and what our presence here means, and your name is going to come up. My name comes up, and I explain that I'm a civilian nurse. Your record comes up, and that explanation has a short shelf life. She folded her arms. What are you saying? He looked at her, directly, the way he always had, the way that had always meant he was about to say something she wasn't going to like, and he was going to say it anyway. I'm saying that tonight was not an accident, he said. I'm saying that the things that happened before I landed, the way this hospital is being run, the patient who almost died this morning because a surgeon didn't listen to you, that's documented now. My team documented it. The inquiry that's going to come out of our presence here has jurisdiction that extends beyond the military. Mara said nothing. And I'm saying, Holt continued, that you're not just a float nurse who got unlucky with her contract. And the people in this building who've been treating you like one are about to find that out. The elevator at the end of the hallway opened. 3 people stepped out, and Mara recognized the posture before she recognized the faces. One was carrying a case that she knew from the shape of it contained communications equipment. The second was in civilian clothes, but moved wrong for a civilian. The third was a woman Mara had never seen before, in a dark suit with a badge on her hip that she hadn't tried to conceal. Not military. Federal. Holt glanced at them and looked back at Mara with an expression that said he was not surprised. They move fast, she said. They were already in the region, he said. Like I told you, this wasn't a coincidence. She looked at the 3 people coming down the hallway. She looked at the federal badge. She thought about the files she'd documented today. Every entry timed, every clinical finding logged, every exchange with Wolf noted with the specificity of someone who had spent years writing reports that could not be disputed. She thought about the way Wolf had looked at her when he'd said you're terminated. She thought about the way the VP of Clinical Operations had studied the middle distance. What do they want? She said. To talk to the nurse who documented everything, Holt said, and after they talked to her. Holt's expression was not quite readable, but it was not uncertain either. You know how this goes, he said. Once this starts, it doesn't stop until the whole picture is visible. The 3 people reached them. The woman in the suit looked at Mara with the direct, assessing look of someone who had done their homework. Ms. Donovan, she said, I'm Special Agent Vance, Department of Defense Inspector General's office. We need to walk through what happened in this hospital today, from the beginning. Mara looked at her. You might want a conference room, Mara said. It's a long list. Vance almost smiled. We have time. And somewhere 3 floors below them, in an office, with a corner view and a folder on the desk, Garrett Wolf's phone was ringing, the kind of call that didn't come from the nursing staff, didn't come from the hospital board, came from a number he'd never seen before and would not be able to ignore. He let it ring twice before he picked it up. The voice on the other end identified itself with a title and an office that made him sit up straight. He said, I don't understand what this is about. The voice on the other end told him, and the color drained out of his face. The color drained out of his face. Wolf set the phone down with the particular careful motion of a man who had just been told something his body was still processing while his mind was trying to find the procedural framework that would make it manageable. He sat behind his desk in his corner office with the door closed and the lights on and the folder in front of him. And for the first time in longer than he could clearly remember, he did not immediately reach for the next action. He sat still. 3 floors up, Mara Donovan was walking into a conference room she had never been in before, pulling out a chair she had never sat in, and beginning a conversation that she had spent the last 4 years making herself unavailable for. The conference room was a standard administrative space. Round table, 8 chairs, whiteboard on one wall, no windows. Agent Vance had taken the chair directly across from Mara. The communications tech had set up a compact recording unit at one end of the table without being asked. The third person, male, late 30s, who had introduced himself as Garrett Paulus, military liaison, sat to Vance's left with a tablet open and a stylus he hadn't used yet. Holt was not in the room. Mara had noted that, and not asked about it. "We're going to start with today," Vance said, "and if we need to go further back, we'll go further back. Walk me through your shift from when you arrived this morning." Mara walked her through it. She did it the way she documented charts, sequentially, with times where she had them, with clinical specifics that were accurate and nothing more. She described Walter Kemp's presentation and her assessment and the two interactions with Wolf. She described the flagging of the chart, the patient advocate line, the exchange at the nursing station. She described the termination meeting. Vance listened without interrupting. Paulus took notes. The recording unit ran. When Mara finished, Vance said, "You made 4 entries in the patient's chart." "Yes." "In a 2-hour window." The situation was evolving. Each entry reflected a change in clinical presentation. Dr. Wolf characterized them as, Vance checked her tablet, redundant documentation designed to create a paper trail rather than address patient care. Dr. Wolf characterized them to whom, Mara said. Vance held her gaze. "He made a statement this evening when we initiated contact. He made a statement before he knew the scope of the inquiry." "That's fair," Vance said. "What would you call the documentation?" "An accurate record of what I observed and when, which is what nursing documentation is." Paulus wrote something. "The patient is stable, Sitz," Vance said. "Walter Kemp's. He's in acute care." "I know." "Dr. Moss ordered the imaging." "After I flagged it for him, yes." "The intervention that stabilized him was ordered by the acute care team, not Wolf." "Also yes." Vance set her tablet down and looked at Mara in a way that was different from how she'd been looking at her. More direct, less procedural. "You documented everything. You went through every channel available to you. You did everything you were supposed to do, and you still got fired." "Yes." "And then you walked back into this building. There was a patient." Vance looked at her for a moment. "There are a lot of hospitals in the country, Ms. Donovan. Most nurses who get fired at the end of a shift don't come back the same evening because they heard helicopters." Mara said nothing. "I'm not asking you to answer that," Vance said. "I'm saying I understand the picture." She picked the tablet back up. "I want to talk about what we found when we reviewed the hospital's records. Not just today's. The last 18 months. What Agent Vance laid out over the next 40 minutes was not a revelation to Mara in the way it might have been to someone who hadn't spent 5 months watching the system at Hartwell Memorial operate from the floor level. But hearing it stated with the flat specificity of a federal investigation gave it a different quality. Like seeing a building you'd been inside suddenly from the outside, the structure visible in a way it never was when you were moving through it. There had been 8 formal nursing complaints about Wolf's conduct over the previous year and a half. 4 of them had been filed through official channels and quietly closed. 2 had been redirected to HR processes that produced no documented outcomes. 2 had never been officially logged at all, though the nurses who'd filed them had email confirmation of submission. 3 of those nurses no longer worked at Hartwell Memorial. 1 had moved to another state. 1 had changed careers entirely. There were 2 prior patient outcome reviews that had flagged delayed intervention as a contributing factor in adverse events. Both reviews had been conducted internally. Both had concluded that clinical protocols were followed appropriately. Both had been signed off by the VP of Clinical Operations. The VP whose name badge Mara had read that afternoon while the woman studied the middle distance during her own firing. "Her name is Hargrove," Vance said. "Denise Hargrove. She's been in the role for 3 years. Her prior position was at a system in Nevada that had some overlap in the pattern of issues." "She followed Wolf," Mara said. Vance looked at her. "What makes you say that?" "The timeline. He was in Nevada before Colorado. I looked him up when I started here. Standard background check on a chief of surgery." Paulus looked up from his tablet. "You checked his background," Vance said. "I checked the backgrounds of senior physicians on new assignments. I've done it for years. It's not complicated. It's public licensing information, hospital affiliation history." "And you noted the overlap with Hargrove." "I noted they'd been at the same Nevada institution. I didn't know what it meant at the time. She paused. I know what it means now. Vance made a note of her own. When we contact you again, and we will need a formal statement, that detail needs to be in it. Understood. Vance closed her tablet. That's what we have for tonight. We're going to need you available over the next several days. Do you have somewhere to stay in Delverton? I live here. Good. She stood. Ms. Donovan, what you did today, both with Mr. Kemp's and with the patient on 6, we're going to make sure that's in the record, the complete record. Mara stood. The man on 6, Castillo. What's his status? Palos checked his phone. Still in surgery. Dr. Reyes is optimistic based on the last update. Mara nodded once. She picked up her bag. She walked out of the conference room and into the hallway and stood for a moment in the particular quiet of a hospital at 10 at night, when the building was still functioning, but the daytime machinery of authority had mostly retreated to its offices or gone home. The hallway smelled the same. The lights were the same. It looked like the place she'd walked out of 4 hours ago, and it was entirely different. Holt was in the hallway. He was leaning against the wall 30 feet from the conference room door, arms crossed, with the look of a man who had been waiting and was not bothered by the waiting. How'd it go? He said. They're building a case. It's going to take time. They don't work slowly when they have the evidence density this situation has. He fell into step beside her as she walked toward the elevator. Castillo is still in surgery. Palos told me. Reyes called it a difficult repair but manageable. The fragment had tracked closer to the intercostal vessels than the initial imaging suggested. She's good. I told you she was. They reached the elevator. Mara pressed the button and they stood in silence for a moment. You should go home, Holt said. Get some sleep. I'm going to check on Walter Kemp's first. You're not on shift. He doesn't know that. Holt was quiet. Then he said, There's something else I need to tell you about why the mission was in this region. She looked at him. Not tonight, he said. It's not something that changes what happens in the next 12 hours, but it's context you should have. Tomorrow, if you're willing. She studied him. The particular way you study someone you know well enough to read when they're holding something back, and well enough to know whether it's the kind of thing to push on right now. Tomorrow, she said. The elevator opened. She got in. He didn't follow, just held her gaze as the doors closed, and she watched him through the narrowing gap, with the feeling that the day had changed something she hadn't fully measured yet, and that the measuring was going to take a while. Walter Kemp's was awake. He shouldn't have been. It was past visiting hours, and the acute care floor had its own charge nurse who gave Mara a look when she appeared. But something in Mara's face or posture, or the simple fact that she walked in like she belonged there, made the charge nurse decide it wasn't worth the engagement. She went back to her station. Mara went to room 4. Walter was sitting up slightly, which was better than he'd been. He had a nasal cannula instead of the mask from this afternoon, which meant his oxygen numbers had improved. There was a dinner tray on his bedside table with the evidence that he'd eaten about half of it. He looked at her when she came in and said, I thought you got fired. I did, she said. She pulled the chair up and sat down. But you're still here. I wanted to check on you. He looked at her with the flat, measuring expression that she'd come to understand meant he was deciding how honest to be. The nurses on this floor told me what happened, the helicopters, the federal people. Word travels. It does. He shifted slightly in the bed. They told me a military unit came in, that there was a patient on 6. Yes. And that a nurse was involved in helping him. She didn't answer. He looked at her for a long moment. I was Army, he said. 30 years. I know what it looks like when someone has a different kind of training than they're letting on. I covered your floor this morning, she said. That's what matters. I'm not arguing with that. His voice was quieter now, the assertive edge gone. I'm just saying I noticed. This morning when you were listening to my chest, the way you moved, the way you looked at that monitor, that's not what nurses look like. Or not most of them. Mara was quiet. I was at Hawthorne Base in the late 90s, Walter said. They had a medic training program for special operations attached, female candidates. Very few of them made it through. He paused. The ones who did. They moved like you move. The room was quiet for a moment. Down the hall, someone's monitor beeped twice and stopped. "How are you feeling?" Mara said. He let the subject change stand. "Better than this morning. The pressure's gone." He looked at his hands. "I've got a daughter in Tucson. They called her. The hospital called her when I went to acute care. She's coming tomorrow." "That's good." "She worries." He said it with the gruff, slightly uncomfortable affect of a man who found being worried about difficult to manage. "I keep telling her I'm fine." "You will be, because someone was paying attention this morning." He looked at her. "Even though they tried to stop you." Mara stood. "Get some sleep. Your daughter's going to want you awake when she gets here." "Hey." He said it before she reached the door. She turned. He was looking at her with a directness that was different from anything in the conversation so far. "Whatever you did tonight, whatever you are or were, I'm glad you're here." She held his gaze for a second. "Sleep," she said, and walked out. She made it to the lobby. She was 20 feet from the exit, close enough that she could see the parking structure through the glass, when her phone rang. She didn't recognize the number, which normally she'd let go to voicemail, but nothing about tonight had been normal, so she answered. "Donovan," said the voice on the other end. Female, clipped, with the acoustic quality of someone speaking from a vehicle. "This is Reyes." Mara stopped walking. "Dr. Reyes, is Castillo? He's out of surgery. He's in recovery. He's going to make it." There was a brief pause, the sound of something, a door, a hallway, in the background. "I'm calling because I need you back in the building." "I'm in the building." "Good. Come to OR recovery, now." "I'm not on staff. I'm aware." "Come anyway." The line cut. Mara stood in the lobby for 1 second. Then she turned around and went back toward the elevators. OR recovery was on the 3rd floor. She got there in 4 minutes and found Reyes outside the recovery suite with a chart in her hand and an expression that Mara had not seen on her face before, which was the expression of a surgeon who had done what they could do and had arrived at the edge of what surgery alone could fix. "Talk to me," Mara said. "He's stable. Hemostasis is good. The repair held." Reyes handed her the chart. "But his pressure is not where it should be post-op. He's not responding to the fluid resuscitation the way I expected. His temp is up, not high enough to be septic yet, but trending." Mara read the post-op notes. "When did the temp start?" 40 minutes into surgery, we've been monitoring." Reyes looked at her steadily. He told the anesthesiologist something before he went under. He was half lucid. He said, and I'm quoting, "Tell Valkyrie the exposure happened first." The hallway was very quiet. "Does that mean something to you?" Reyes said. She said it in the flat, clinical tone of someone who was asking a medical question and not a personal one. Mara stared at the chart. Exposure. The word had a specific meaning in field medicine, not the lay usage, not environmental exposure, but a technical one. It referred to a situation where a combatant had contact with a substance, compound, or environment that produced a systemic response distinct from the mechanical injury. You treated the wound, and the wound healed, and the patient still deteriorated, because the wound was not the problem. The problem was what had accompanied the wound. "I need his full intake history," she said. "Everything from the field, whatever his team documented before he was transported." I asked Commander Holt. He said the mission record is classified. "Tell Holt I need it anyway." Reyes looked at her. "That's not a request I have the standing to make." "Then I'll make it." Mara handed the chart back. "Keep him on broad-spectrum coverage. Watch his renal panel. If his creatinine starts moving, I want to know." "You're not on staff." "I know." Mara was already moving toward the door. "I'm working on that." She found Holt in the waiting area outside the recovery wing. He was sitting in one of the institutional chairs with his forearms on his knees, which was the closest thing to a relaxed posture she'd ever seen him adopt. He stood when she came through the door. "The exposure," she said. His face changed. Not dramatically. A compression around the eyes, a stillness that spread from the center outward. "He told them," Holt said, "before he went under." "Yes." She stepped closer and dropped her voice. "What was it?" Holt looked at her for a moment with the specific calculation of a man deciding what level of classified he could breach in a hospital hallway. "Deacon," she said. It was the first time she'd used his name, and they both registered it. "He's spiking a temp, and his pressure is soft. If there was a secondary exposure on that mission, I need to know what it was." Reyes can manage the surgical repair. This is different. A beat. We were in a facility, he said quietly. Abandoned pharmaceutical compound. Mountain region. The team reported an aerosol release during the breach, unintentional, from compromised storage containers. The medic assessed everyone and cleared them. Castillo was the only one with the penetrating injury, so he was the focus. What was in the containers? We don't know definitively. Preliminary field analysis suggested a modified vesicant compound, low concentration. The medic didn't see systemic signs during the initial window. Mara stood with this information, and her mind ran through it the way it had been trained to run through it, very fast and without the emotional component, because the emotional component was not useful right now. Modified vesicant exposure with delayed systemic presentation, combined with surgical trauma, combined with the fluid shifts of a repair procedure. It was a specific clinical picture, and it was not one that standard post-op management was designed to address. I need to talk to Reyes, she said, and I need the field medic's notes, whatever he documented, classified or not. I can get you the medic's notes, Holt said. How fast? 30 minutes. Make it 20. She turned back toward the recovery suite door. And Holt, this is why he's not responding to fluids. I know. If this isn't treated as a vesicant exposure and managed accordingly, the post-op numbers are going to keep degrading. I know, Mara. His voice had a quality she hadn't heard in years. That's why I called your name in the lobby. She looked at him one more time, then she pushed through the door. Reyes looked up when she came back in. She was at the bedside, adjusting something on the IV line, and she read Mara's face with the rapid accuracy of a surgeon who had been reading clinical faces for 20 years. What is it? She said. I need to talk to you about a secondary exposure, possible vesicant compound, aerosol, low concentration. Mara moved to the other side of the bed. It would explain the temperature trend and the pressure response. Reyes looked at her. Where did you get that? From the commander, just now. That's not standard post-op presentation. I know what it is. Mara looked at her steadily. I've managed it before, not in a hospital, under different conditions. But the principle is the same. She looked at the monitors. Do you have hydroxycobalamin in your pharmacy? For cyanide protocol, yes. I need you to check your vesicant management inventory, specifically BAL and DMSA. If the compound was sulfur-based, we're not a military trauma center, we don't stock, then we need to find out what's available, and we need to find out now. Mara said it without heat, not urgently, not frantically, but with the flat precision of someone stating a sequence of necessary events. He's 41 years old, and he survived the surgery. I'm not going to let him lose the next 6 hours to a pharmacy gap. Reyes looked at her. The look was long and very direct. You've done this, Reyes said. This specific thing. Yes. Under what circumstances? Not ones I can describe in this room tonight. Mara held her gaze. Can you trust me? The recovery suite was quiet except for the monitors and the ambient hospital sound coming through the walls. Reyes looked at Castillo, at the post-op pallor of him, the readings on the screens, the fragile stability of someone who had gotten through the worst and was now in the specific danger zone that came after the worst, when the body was depleted and the secondary threats moved in. Tell me what you need, she said. Mara told her. They were 8 minutes into reorganizing the post-op protocol. Reyes on the phone with the pharmacy, Mara at the bedside calculating weight-based dosing on the chart that Holt had not yet delivered but that she was preparing for, when the door to the recovery suite opened. It wasn't Holt. It was Garrett Wolfe. He was in street clothes, which meant someone had called him in, and his face had the controlled fury of a man who had spent the last 2 hours in a very bad conversation and had arrived at a destination that felt like action. He looked at the room, at Reyes on the phone, at Mara at the bedside, and his eyes landed on Mara with the specific quality of a man who had been told something he couldn't process and had decided to process it here, in person, at 10:40 at night in an OR recovery suite. What is she doing in here, he said. She was terminated 6 hours ago. Reyes kept talking on the phone. Mara didn't look up from the chart. I'm talking to you, Wolfe said, louder. You don't have staff privileges in this hospital. You don't have credentials to be at that bedside. I want you removed from this room right now." The monitors ran their quiet lines. Castillo's chest rose and fell. Mara finished writing the dosing calculation. She capped the pen. Then she looked up at Garrett Wolfe, and whatever he saw in her face stopped him. Not what he'd expected to see. Not deference and not anger, but something quieter than either. And in that quiet, something that registered, finally, as the thing she actually was. "This patient," she said, "has a secondary chemical exposure on top of a penetrating injury and 2 hours of surgery. His temperature is trending up and his pressure is soft, and his post-op management needs to account for a vesicant compound that his field medic didn't catch in time." She held Wolfe's gaze. "If you want to stand in this doorway and argue credentials, that's your choice. But I'm going to keep writing orders until Dr. Reyes either endorses them or replaces them with something better." Wolfe stared at her. "And when Agent Vance from the Department of Defense Inspector General's office asks tomorrow why you came to the recovery suite at 10:40 at night to remove a clinician from a critical patient's bedside," she said, "you're going to need a better answer than what you're thinking right now." The room was completely silent except for the monitors. Wolfe looked at Reyes, who had finished her call and was standing at the medication cabinet with her back slightly turned, a position that was not accidental. She did not look at him. She opened the cabinet and began checking inventory with the focused efficiency of someone with no attention left over for the conversation behind her. Wolfe looked back at Mara, and something in him, the authority that had operated here unchecked for 3 years, the institutional weight he'd carried into every room, the certainty that his voice was the last word, shifted. Not collapsed. Shifted. A millimeter. The way a foundation shifts before anyone on the surface can see what's happening below. He said nothing. He stepped back. The door swung closed behind him. Mara looked at the chart. Her hands were steady. Reyes came to the bedside with 2 vials and a controlled expression. "Pharmacy has BAL in stock. Small supply, enough for initial dosing." She looked at the calculations Mara had written. "Walk me through your reasoning." Mara walked her through it. She was midway through the second line of the protocol, explaining the timing sequence, the monitoring parameters, the signs that would indicate the compound had been sulfur mustard variant versus the phosgene adjacent class, when her phone buzzed. She checked it. A message from a number she didn't have saved. 11 words. Full field record transmitted to Rhea's secure hospital email. Holt. And then, a second later, a second message from the same number. Wolfe just made a call to the board chairman. "You have maybe 2 hours before this escalates past the IG's jurisdiction." Mara stared at the screen. 2 hours. She put the phone back in her pocket and looked at Reyes. "We need to move faster," she said. "We need to move faster," she said. Reyes didn't ask why. She read something in Mara's face and made the decision that experienced clinicians make when they're working alongside someone they've begun to trust. She moved. The next 90 minutes were the kind of work that Mara had not done in 4 years, and that her body remembered with a clarity that surprised her. Not the field version. No field version had a pharmacy and a recovery suite and a surgeon standing across the bed recalibrating every parameter in real time. But the same essential quality, which was the work of keeping a person alive while the situation around them was actively trying to prevent it. Castillo's initial response to the BAL was not dramatic. It was a slow stabilization, a temperature that stopped climbing and held, a pressure that found a floor and stayed there instead of continuing to drift. Small movements on the monitors, the kind that meant something if you understood what you were watching and nothing if you didn't. Reyes understood. She stood at the foot of the bed with her arms crossed and watched the numbers with the specific focused patience of a surgeon who had learned that sometimes the work was done and then you waited to find out if the work was enough. "His color's better," she said, 20 minutes in. "Yes," Mara said. "How long before we know if the first dose held?" "Another hour. If his temp doesn't rebound in the next 60 minutes, we're probably on the right track." "Probably," Reyes said. "It's the best word I have." Reyes looked at her. "Where did you learn vesicant management protocol?" "Field training." "Whose field?" Mara checked the IV line. "The kind that doesn't have a name on a curriculum." Reyes was quiet for a moment. "The commander. Holt. He's outside." "I know." "He's been outside since Wolfe left, standing in the hallway, not asking to come in." "That's Holt." "Is he?" Reyes paused, selecting the word carefully. Is he someone you trust? Mara thought about the question with more honesty than she usually allowed herself when it came to Deacon Holt. In the field, she said. Yes, without question. She paused. Outside of it is more complicated. Reyes accepted this without comment. At the 40-minute mark, Castillo's temperature dropped a quarter point. It wasn't much. In a different context, it wouldn't mean anything. Here it meant the body was beginning to respond to the treatment rather than fighting past it, and Mara felt something in her chest release a fraction. Not relief, not yet, but the first loosening of the sustained tension that had been there since she'd read his post-op chart. She stepped into the hallway to tell Holt. He was exactly where Reyes had said, leaning against the wall, not on his phone, not talking to anyone, just there in the way he was always just there, present without being intrusive, which was a quality she'd spent years trying to understand and had eventually concluded was simply his nature. Temp dropped, she said. He's responding. Holt closed his eyes for 1 second. Just one. Good. He's not clear yet. We need the next hour. I'll be here. She started to go back in. Mara. He said it quietly. Wolf made the call to the board chairman 40 minutes ago. I have someone monitoring the communication chain. The chairman is convening an emergency session. At midnight. Apparently, when a federal investigation lands on your institution, midnight sessions become reasonable. She turned back. What are they trying to do? What they always try to do. His voice was flat. Get ahead of it. Control the narrative before the IG releases anything. They're going to position this as a rogue clinician acting outside her scope, a military incursion that violated civilian hospital protocols, and a misunderstanding about a patient outcome that was already being managed appropriately. He paused. They're going to try to make you the story instead of Wolf. She looked at him. They can try, she said. They have lawyers on retainer who have done this before. So does the Department of Defense. Something in his expression shifted. Not quite a smile, but the closest thing to relief she'd seen on him tonight. Yes, he said. It does. She went back inside. The board chairman's name was Douglas Ferrer, and he had run Hartwell Memorial's governing board for 11 years with the particular skill set of a man who understood that institutional reputation was a financial instrument and treated every threat to it accordingly. He was 63, silver-haired, and had the smooth, careful manner of someone who had spent decades in rooms where the stakes were high and the language was always controlled. He arrived at the hospital at 11:15. He was met in the lobby by Agent Vance. The conversation that followed, in the same conference room where Vance had spoken to Mara 3 hours earlier, was not recorded in the same way, but Paulos was present, and the notes he took were thorough. Ferrer came in with 2 attorneys and a prepared statement. Vance came in with the 18 months of complaint records, the internal review documents, the cross-reference timeline from the Nevada institution, and a federal subpoena for the hospital's full personnel and incident files that had been signed that afternoon by a judge in Denver. Ferrer's prepared statement lasted 4 minutes. The subpoena discussion lasted considerably longer. Mara didn't know any of this was happening in real time. She was in the recovery suite watching Castillo's monitors and recalculating his second dose timing with Reyes. She found out about Ferrer's arrival the same way she'd found out about most things tonight, through her phone, through Holt, in short factual messages that landed without context and required her to fill in the gaps. Ferrer is here. Vance has him in conference room 2. His attorneys are good, but the subpoena is airtight. Oh, Paulos. Then 20 minutes later, Hargrove just arrived, separately from Ferrer. She asked for Vance before she was asked for. Holt. That one Mara read twice. Hargrove, the VP of Clinical Operations. Denise Hargrove, the woman who had studied the middle distance during Mara's termination meeting, had come to the hospital voluntarily in the middle of the night and asked for the federal investigator before the federal investigator came for her. That was not the move of someone protecting the institution. That was the move of someone who had decided the institution was no longer worth protecting. Mara set the phone down and looked at Castillo's temperature on the monitor. It had dropped another third of a point. His pressure was climbing slowly toward a range that Reyes had described, with characteristic surgical understatement, as more acceptable. His color's better, Reyes said from the other side of the bed. She said it the same way she'd said it 40 minutes ago, but the tone was different now. Less assessing, more confirming. The difference between watching for evidence and finding it. Yes, Mara said. We should know within the next 30 minutes whether the second dose is necessary. His renal panel, holding. Creatinine is stable. Reyes paused. You were right about the vesicant class, the field record Holt sent. The compound markers matched sulfur mustard variant. If we'd treated this as standard post-op inflammation, we'd be managing a different conversation right now. Mara didn't say anything. There was nothing useful to say. I want to ask you something, Reyes said. She kept her eyes on the monitor. And you don't have to answer it. Okay? Do you want to come back? The recovery suite was quiet. The monitors ran their steady lines. Down the hall, a door opened and closed. To this hospital, Mara said. To this work. Clinical work. Not float coverage on whatever floor needs a warm body. Reyes looked at her now. You're a trauma resource. You know it. I know it. What happened today with Kemp's and what happened tonight with this patient, that's not something you can train. It's experience and judgment and the specific kind of attention that comes from having done this in conditions that most people in this building cannot imagine. She paused. The question is whether you want to use it. Mara looked at Castillo, at the slow, steady evidence of his improvement on the monitors. I've been thinking about that, she said. Tonight, specifically. And? I don't have an answer yet. Reyes nodded. Fair enough. She looked back at the monitors. For what it's worth, whatever the board does tonight, whatever the lawyers arrange, however the investigation shakes out, I'm going to document what happened in this room, accurately, fully. And I'm going to be very specific about who made the calls that kept this patient alive after I closed him up. You don't have to do that. I know. A pause. I'm going to do it anyway. Hargrove's conversation with Vance lasted 2 hours and 20 minutes. Mara learned the shape of it in pieces over the following days, from Paulos and from Holt, and eventually from Vance herself, in a follow-up meeting that happened 4 days later in a federal building in Denver. But the essential outline became clear by the following morning. Denise Hargrove had been Garrett Wolf's administrative cover for 3 years. Not unwillingly. That was the detail that changed the texture of the whole picture. She hadn't been pressured or manipulated into it. She had come from Nevada already knowing what she was protecting and had taken the role at Hartwell Memorial with full knowledge of the pattern, because Wolf was the kind of chief of surgery who produced outcomes that boards liked to cite in their annual reports. And outcomes that boards liked were connected to funding that kept VPs of clinical operations employed. She had closed the complaints. She had redirected the HR processes. She had signed off on the internal reviews. What she had not done, and what had apparently been the thing that broke the arrangement, at least in her own accounting of it, was know that the 2-hour delay in Walter Kemp's treatment on the morning of the investigation's arrival had been preceded by 3 previous incidents in the past 14 months involving the same pattern. Delayed intervention. Wolf's sign-off that things were managed appropriately. Patients who recovered but who would have recovered faster, better, with fewer complications if the delay hadn't happened. She had known about one of them. When Vance showed her evidence of all 3, Hargrove had asked for a 10-minute break, sat alone in the conference room, and when Vance came back, she had begun to talk. She talked for 2 hours and 20 minutes. She named dates. She named files. She identified the location of internal documents that had been archived in a manner designed to be retrievable by Wolf's office and invisible to standard audit processes. She described the Nevada pattern in detail that the Nevada institution's own investigation had never fully assembled because she had been there for the end of it and had understood what to obscure and what to let surface. She did all of this, as Paulos later described it to Mara, with the flat efficiency of someone who had made a decision and was executing it completely without visible emotion, because visible emotion would have implied she was surprised by where the decision had led. Mara sat with this for a long time when she first heard it. Not with anger, exactly. Anger was too simple for what the information produced. More with the specific, uncomfortable recognition of the distance between how institutions looked from the outside and what they were actually made of on the inside, and the number of people who understood that distance and chose to profit from it rather than close it. What happened to Wolf in the days that followed was not fast, and it was not clean, because things like this never were. His privileges were suspended by the board within 48 hours of Hargrove's statement. Suspended, not revoked, which was the board's attempt to manage the situation without fully acknowledging its magnitude. Vance's office pushed back on that with the kind of quiet, documented insistence that federal investigations produced when they had the evidence density to support it. And within the week, the suspension had been extended pending the outcome of the formal inquiry, which had been expanded to include the Nevada incidents. His office was occupied by the interim chief they brought in from a hospital in Salt Lake City. His name was not on the website. His chair had a different person in it. Mara knew none of this on the night it began. On the night it began, she was in an OR recovery suite, watching a man's temperature normalize on a monitor, and she was tired in the deep way that came not from the hours, but from the sustained quality of attention that the hours had required. And she was sitting in the chair beside Castillo's bed because Reyes had told her to sit down, and she had, for once, listened. She was sitting there when the door opened. It was Holt. He looked at the monitors first, the professional reflex, assessing the patient before anything else. And then he looked at her. "His numbers are better," he said. "Yes." "You should go home. You said that 4 hours ago." "I was right then, too." She looked at him. In the recovery suite light, he looked tired in the way that operational stress produced. Not sleepy, but worn at the edges, the sustained focus having cost something that wasn't immediately visible. "You said you'd tell me the rest of it tomorrow," she said. "About why the mission was in this region." "It's technically tomorrow." "Then tell me." He pulled the other chair from the wall and sat down. He leaned forward with his forearms on his knees, which was the posture he used when he was going to say something that mattered, and he wanted to be close to the ground when he said it. "The facility where the exposure happened," he said. "The abandoned pharmaceutical compound. We were there because of an intelligence flag on the compound's previous operator. Research activity that crossed several treaty lines." He paused. "The compound has a licensing history. It was sold 8 years ago from a parent corporation. The parent corporation had a facility services contract with 3 hospital systems in the mountain region." Mara was very still. "One of those hospital systems," Holt said, "is the parent network that Hartwell Memorial belongs to." The recovery suite was quiet. "That's not a coincidence," she said. "No," he said. "It's not." He looked at her steadily. "The connection between the compound's research operation and the hospital network. We don't know the scope of it yet. The IG's office is treating it as a separate but parallel inquiry. What we know is that someone at a governance level in this network had financial ties to the compound's operating entity up until 4 years ago." 4 years ago, Mara said. "Yes." She thought about that for a moment. The timeline of it. The way it intersected with other timelines she knew about but hadn't connected. "Is Wolf in that loop?" "We don't know. We're building the picture." He paused. "But Ferrer, the board chairman, his financial disclosure records going back 6 years have some entries that Vance's office is very interested in." Mara exhaled slowly. "So tonight," she said, "this wasn't just a hostile chief of surgery and a bad administrative culture." "No," Holt said. "It wasn't." He looked at her. "And the documentation you created today, the chart entries, the nursing notes, the patient advocate log, that documentation is now part of a federal record that connects to something larger than one hospital's internal politics." She sat with that. "You knew," she said. "When you landed, you knew there was a chance this was connected." "I knew there was a chance," he said. "I didn't know what you'd walked into." A pause. "If I had, I would have called sooner. You don't have my number. I would have found it sooner." She looked at the monitors. Castillo's pressure was reading in a range that Reyes had called earlier, almost satisfactory, which in surgeon language meant she was pleased. His temperature was holding. His color, even in the recovery suite light, was better than it had been 2 hours ago. "He's going to make it," she said, not a question. "Because of what happened in this room tonight," Holt said. "Because Reyes is a good surgeon. Because you knew what the field record would say before you read it." He said it without argument in his voice. "Because you've spent 4 years trying to be invisible, and you still walked into that room." She didn't respond to that. "Mara." He said her name the way he'd said it in the hallway earlier, not as a preamble to something, just as itself. I need to tell you something else. There's more. There's more. He paused. Vance's office has been in contact with Kemp's daughter. She's a healthcare attorney. Mara looked at him. She called the hospital at 8 tonight, after she got the call about her father, and asked for documentation of his treatment today. They told her they'd need to process the request through standard channels. He paused. She told them she'd have a subpoena by morning. Mara stared at him. She's already coordinating with a patient advocacy organization, he said. 3 of the former nurses who filed complaints in the last 18 months are in contact with that organization. Hargrove's name has already been mentioned in the context of the complaint closures, the shape of it assembled in front of her, the federal inquiry, the board session, Hargrove's statement, the financial ties, the Nevada pattern, and now a patient's daughter who was a healthcare attorney, and a patient advocacy organization, and 3 former nurses who had been waiting for someone to make the first move. It was not a single thing that had happened tonight. It was a convergence, a set of separate lines that had been moving toward each other for years, some of them for longer than she'd been at this hospital, and tonight had been the point where they arrived at the same location simultaneously. And at the center of it, not because she'd planned to be there, not because she'd wanted to be visible, but because there had been a patient in room 412 who needed someone to pay attention, was a timed nursing note in an electronic chart and the name of the nurse who had written it. They're going to want to talk to you again, Holt said. Not just Vance, the attorney, possibly others. I know. It's going to become public. I know. Are you ready for that? She looked at him for a long moment. The question was larger than it seemed, not just about press coverage or professional exposure, but about the version of herself she'd been living for 4 years, the carefully reduced footprint, the deliberate invisibility. She had built that life for reasons that had made sense at the time, and some of them still made sense, and some of them, tonight, were harder to defend. No, she said. But that's not the right question. He waited. The right question, she said, is whether it matters if I'm ready. He held her gaze. It doesn't, she said. So. She stood up. She picked up the chart from the bedside table and made the final notation for the shift. Time, patient status, medications administered, clinical reasoning, her name, and she set it down. She looked at Castillo one more time. Then her phone buzzed. She checked it. The message was from a number she recognized now. Paulos. Wolf just sent a formal statement to the board through his attorney. He's claiming the military presence tonight was unauthorized and that clinical decisions made in this facility by non-credentialed personnel constitute a patient safety violation. He's filing a complaint with the state medical board against Reyes for allowing it. He's naming you specifically as an unauthorized practitioner who interfered with established care protocols. She read it twice. Then the second message arrived. He's also claiming your military record was fraudulently represented to hospital staff tonight, that you misrepresented your credentials and your identity to gain access to a patient. Mara stood in the recovery suite with her phone in her hand and the monitors running their quiet lines behind her, and something in her expression went very still. Holt was watching her. She turned the phone so he could read the messages. He read them. His jaw tightened once. He's desperate, he said. He's also very good at this, she said. He's done it before, in Nevada. She looked at him. If he gets that complaint filed before Vance's investigation becomes public record, it controls the sequence. He becomes the aggrieved party. The story becomes about my credentials, not his conduct. The IG's office works on federal timeline, she said. The state medical board complaint is a different jurisdiction. It moves differently. And the board chairman, Fair, he's been managing Wolf's reputation for 11 years. Even talking to Vance tonight, he's going to hedge. He's going to try to keep the door open in both directions. Holt looked at her. What do you need? She thought for 3 seconds. My full service record, she said. Unredacted. Every deployment, every qualification, every commendation, everything that proves exactly who I am and what I've been trained to do. She met his eyes. Can you get that released? Holt's expression was still. Getting your record released, he said carefully, means it becomes part of the public inquiry. It means people know. I know what it means. Mara, can you get it released? She said. A long pause. Yes, he said. I can. Then do it, she said. Before morning. Then do it, she said. Before morning. Holt made the call at 12:47 a.m. from the hallway outside OR recovery, and Mara stood on the other side of the door and listened to the silence of the recovery suite and made herself breathe steadily while the things she'd spent 4 years keeping contained moved toward becoming public record. She had known, somewhere under the deliberate quiet of the last 4 years, that this was always the shape the future would take. Not this hospital, not this night specifically, but something like it. A situation that would make the choice for her, because she had never been genuinely capable of the alternative. She had told herself she was choosing civilian life. What she had actually been doing was waiting for a reason strong enough to justify coming back to herself. 41 years old, a terminated float contract, and a man with a sulfur compound in his bloodstream who was currently breathing steadily because someone had known what to look for. That was the reason. She didn't feel heroic about it. She felt tired and a little raw and aware that the next several days were going to require a quality of sustained engagement that she hadn't needed in years. But underneath the tiredness was something else, something she recognized from the field, from the work, from the version of herself that had operated under a call sign, places that didn't appear on maps. A solidity, the specific groundedness of a person who has stopped pretending to be smaller than they are. Holt came back through the door at 12:53. "It's done," he said. "The record release request is in. It'll be processed through the IG's office by 0600. Paulos will have it. Paulos will have it." He looked at her. "Vance wants to add it to the formal evidentiary package before Wolf's attorney can file the complaint with the state board. She needs 2 hours." "She'll have them," Mara said. "Wolf won't move before morning. He's waiting to see what the board does first. You know how he thinks. I know how people think when they're protecting something they've built over a long time and they can feel it coming apart." She paused. "He's going to try one more thing before he files. He's going to go to Ferrer and ask the board to get ahead of the federal inquiry by issuing a voluntary corrective action statement that positions everything as an internal matter already being addressed." Holt looked at her. "That's a specific prediction." "It's what I would do if I were him and I'd spent 11 years building a relationship with a board chairman who has financial reasons to keep the institution's name clean." She sat back down in the chair beside Castillo's bed. "It won't work, but he'll try it." She was right. At 7:14 the following morning, Wolf's attorney submitted a draft corrective action framework to the board, a 12-page document that acknowledged procedural gaps in patient communication protocols, proposed a voluntary internal review, and requested a 60-day administrative pause on any external inquiry processes. It arrived 3 hours after Paulos received Mara's unredacted service record, and 40 minutes after Vance's office formally incorporated that record into the federal evidentiary package, which, by the procedural rules governing DODIG investigations with civilian institution overlap, triggered a jurisdictional hold on any state-level complaint filings connected to the same set of facts. Wolf's medical board complaint against Reyes never cleared the intake desk. His complaint naming Mara as an unauthorized practitioner was reviewed, logged, and placed in a pending file that would remain pending for the duration of the federal investigation, which was projected to take between 8 and 14 months. The board's emergency session, which had reconvened at 8 in the morning with Ferrer and 3 additional board members and 2 corporate attorneys, received the jurisdictional hold notification at 9:05. One of the corporate attorneys asked for a 20-minute recess. The recess lasted 45 minutes. When they came back, Ferrer submitted the board's formal request to cooperate fully with the IG's investigation and announced the immediate appointment of an independent patient safety review committee with external oversight. He did not mention Wolf by name in the announcement. He did not have to. By 10 o'clock, the suspension of Wolf's clinical privileges had been upgraded to indefinite administrative leave pending investigation, and the language in the internal memo, which Paulos obtained through the document subpoena and which Mara read sitting in a coffee shop 2 blocks from the hospital with a cup she'd barely touched, was specific enough that there was no administrative interpretation that could make it look like anything other than what it was. The memo named the patient complaint pattern. It named the Nevada institution. It named the internal review documents that Hargrove had identified the location of during her 2-hour conversation with Vance. It named the dates and the files and the 3 nurses whose complaints had been closed without action. It named Denise Hargrove as a cooperating party in the federal investigation, which was the board's way of acknowledging that she had talked and that what she had said was credible, and that the institution's best remaining option was to position itself as responsive rather than complicit. Mara read the memo twice. She drank some of the coffee. It had gone cold. She thought about Wolf saying, "You're terminated," Ms. Donovan in his corner office with the folder on his desk. She thought about the specific quality of certainty in his voice, not cruelty, not exactly, but the total absence of doubt that the situation was his to decide. The confidence of a man who had been the final word in every room he'd walked into for so long that the idea of a different outcome had become structurally unavailable to him. She didn't feel satisfied in the way that the word satisfaction usually implied. What she felt was more like the particular relief of a thing that was true finally being documented as true. That was quieter than satisfaction. It was also more durable. Her phone buzzed. "He's leaving the building, security escort to his car." "Palos." She didn't look up from her coffee. Mayet. Walter Kemp's daughter arrived at Hartwell Memorial at 11 in the morning, and her name was Sandra, and she was 38 years old, and she had driven through the night from Tucson with a travel coffee mug and a legal pad, and the specific focused energy of a woman who had been frightened for her father and had converted that fear, as she apparently converted most things, into preparation. Mara met her in the hallway outside Walter's room because Sandra had asked for her specifically, had asked the charge nurse, had asked the patient coordinator, had tracked down the name from the nursing documentation in her father's chart, and asked to speak to her before she went in to see him. Sandra Kemp's was shorter than Mara expected and had her father's flat, assessing gaze. She shook Mara's hand with a grip that meant business and said, "You're the one who flagged his condition yesterday morning." "Yes." "And then documented it through every channel available before they fired you." "That's accurate." Sandra looked at her for a moment. "I've been a healthcare attorney for 9 years. I've seen a lot of nursing documentation. What you put in his chart yesterday is the most clinically precise and procedurally thorough set of nursing notes I have encountered in a non-litigation context." Mara said, "I document what I observe. I know. That's what makes it useful." She paused. "I want you to know, the patient advocacy work, the contact with the former nurses, the subpoena request I filed this morning, that's all going forward regardless of what the federal investigation does. The federal inquiry handles the federal dimensions. What happened to those nurses? What happened to the patients in those reviews? That needs a civil track as well. I'm aware. I may need your testimony." "I know." Sandra studied her. "You don't seem surprised by any of this." "I'm not," Mara said. "I'm tired. There's a difference." Something in Sandra's expression relaxed slightly. The professional armor down a degree. "How is he, really?" "Better than he was yesterday morning. His drainage is clean, his oxygen is stable, and the intervention team said the procedure went well." Mara paused. "He ate most of his dinner last night. That's usually a reliable indicator." Sandra almost smiled. "He's been eating hospital food without complaining?" "He complained about the coffee." "That's him." She looked at the door to her father's room. "Thank you for paying attention when it would have been easier not to." Mara didn't say "you're welcome" because it wasn't the right response, and Sandra Kemp's looked like a woman who would notice the difference. She said, "Go see him. He was asking about you." Bolt. Castillo was moved out of OR recovery and into a monitored step-down room on the afternoon of the second day. Reyes delivered the news to Mara by text in the flat clinical shorthand of a surgeon who communicated efficiently. "Step down. Temperature normal 18 hours. Pressure stable. He's eating." R. Mara was at home when she received it. She was sitting at her kitchen table with the curtains open, the Colorado light coming in flat and clean across the mountains, and she sat with the message for a moment before she set the phone down and looked out the window. She had slept 6 hours, which was not enough and was more than she'd expected. She had spent part of the morning on a call with Vance's office that had covered the formal structure of her upcoming deposition, and part of it in a conversation with a union representative from the Nurses Association who had somehow gotten her number and who had asked, with careful professional language that barely contained its urgency, whether she would be willing to speak at an upcoming patient safety forum. She had said she would think about it. She was thinking about it. The knock at her door came at 2 in the afternoon, and it was Holt, which she had not expected, and also had, in the way you anticipated things you hadn't consciously decided to anticipate. He was in civilian clothes, which looked only slightly wrong on him, and he was carrying 2 cups of coffee from the place near the hospital that she'd mentioned once, months ago, in a context that had nothing to do with him. She opened the door and looked at the cups. "You remembered that," she said. "I remember things," he said. She let him in. They sat at the kitchen table with the mountain light coming in, and he told her the rest of it. The parts he hadn't told her in the hospital, the fuller picture of the mission and the compound and the financial connection to the hospital network's parent corporation, which had now become a separate but linked inquiry with a different federal agency involved. He told it without dramatizing it, which was the right way to tell it, and she listened without interrupting, which was the right way to hear it. When he was finished, she wrapped her hands around her coffee cup and said, "How deep does it go?" "We don't know yet," he said. "Deep enough that the investigation isn't going to be quiet. There are going to be people who want to understand exactly what happened at that compound and what the connection was to the institutions that had financial relationships with its operating entity." Ich fand's. He paused. "And there are going to be questions about whether the pattern of complaint suppression at Hartwell Memorial was connected to an interest in keeping the institution's reputation stable during the period when those financial ties were active. Wolf might have been a tool," she said, "not just a bad surgeon with a bad administrator running cover. He might have been, or he might be exactly what he looks like, and the financial connection is a separate strand that intersects with his pattern without causing it." Holt looked at her. "That's what investigations are for." She nodded. "There's something I need to ask you," he said. He said it in the same register as everything else he'd said this afternoon. Direct, without build-up, which was how she preferred it. "The inquiry is going to produce a public record. Your record release is going into that. Your involvement in both patient situations, Kemp's and Castillo, is going to be part of the documented timeline." He paused. "That means Valkyrie becomes part of a public federal document." She looked at him. "I know. The quiet life? It wasn't really quiet," she said. "It was just small." She looked at her hands around the coffee cup. "Small is not the same as peaceful. I've been confusing those two things for 4 years." He was quiet. "I've been treating invisibility like it was the same thing as safety," she said. "It's not. It's just absence. And absence isn't the same as healing. I think I knew that. I just didn't know what to do with knowing it." The mountain light shifted. A cloud moved somewhere above the ridgeline. "Reyes asked me if I wanted to come back," she said, "to clinical work." "What did you tell her?" "That I didn't have an answer yet." She looked at him. "I have one now." He waited. "Not to Hartwell Memorial," she said. "Not in the same capacity, but yes, to the work." She paused. "There's a trauma education program. Reyes mentioned it. Civilians and first responders, field trauma training, tactical medical skills. She said they've been trying to find someone who can bridge the military and civilian clinical worlds, and every candidate they've found has been strong in one area or the other, but not both." "You're both," he said. "I know what I am," she said. Came out quieter than she intended and more settled. "I spent 4 years acting like that was a problem to be managed. It's not." She set her coffee down. "It's just what I am." Holt looked at her for a long moment. "Good," he said. It was a single word and he didn't expand on it, and that was the right choice, and she was glad for it. Garrett Wolf's medical license was placed under formal review by the state board 6 weeks after the federal investigation became public record. The review was initiated not in response to Wolf's own filing, which had never cleared intake, but in response to a formal referral from the IG's office, supported by the patient safety findings from 3 separate incident reviews that the independent committee had completed in their first 30 days of operation. The findings were specific. They were dated. They were cross-referenced with Hargrove's testimony and with the internal documents she had identified, which had been retrieved from the archive system exactly where she said they would be. The state board's review was projected to take 6 months. The 3-member panel included an external physician reviewer from a university medical center, a patient advocacy representative, and a retired judge. Their work was public record. Denise Hargrove resigned her position voluntarily, before the board could act. Her resignation letter, which became part of the institutional record and was therefore subject to the document subpoena, contained one sentence that stood apart from the standard administrative language surrounding it. I understand that cooperation is not the same as absolution, and I am prepared to accept the difference. Mara read that sentence and sat with it for a while. She didn't feel contempt for Hargrove. She felt something more complicated. The recognition that people made choices in conditions of institutional pressure that they might not make in isolation, and that understanding how those choices happened was not the same as excusing them. Both things could be true. Most true things were like that. Douglas Ferrer announced his retirement from the board chairmanship 8 weeks after the investigation became public. The announcement cited personal reasons and a desire to support the institution's transition. No one in a position to comment publicly said otherwise. The 3 nurses who had filed complaints that Hargrove had closed were contacted by Sandra Kemp's firm. 2 of them agreed to participate in the civil process. One had moved on and did not want further involvement, which was her right, and the case was built carefully around what was available and documented without requiring more from her than she was willing to give. Walter Kemps went home 12 days after his admission. His daughter drove him. He sent Mara a note through the hospital's patient communication system. 4 lines, no decoration, the handwriting of a man who wrote rarely and meant everything he committed to paper. I've been in situations where someone paid attention when it cost them something. I know what that looks like. Thank you for being that person. W. Kemps. She read it 3 times. She didn't archive it. She printed it and put it on her kitchen table. And it was still there 6 weeks later, weighted down by a coffee cup, when she sat across from the director of the Regional Trauma Education Program and laid out what she could bring to the role. The conversation lasted 90 minutes. The director, a woman named Okafor, direct and precise, who had spent 15 years in emergency medicine before moving into training, listened to the full accounting of Mara's background without interrupting. When Mara finished, Okafor looked at her for a moment and then said, "You've been doing this work the whole time, just without the infrastructure." "Yes," Mara said, "we can fix the infrastructure." The offer was formal within the week. Ishwamasin. Castillo was discharged on day 9. He walked out of Hartwell Memorial on his own, which Reyes had said was optimistic and which he achieved anyway, in the particular fashion of people who have been told their body's limitations and have decided to negotiate directly with those limitations rather than accept the projected timeline. He stopped in the hallway outside the step-down unit where Mara happened to be. She'd come in for a meeting with the independent committee who wanted her perspective on the nursing complaint process, and the timing was coincidental, which she had long since stopped believing was a category that applied reliably to her life. He was taller than he'd seemed horizontal. He moved carefully, the way people moved when they were managing pain they hadn't fully admitted to. He stopped when he saw her. "Valkyrie," he said. "Castillo," she said, "you saved my life." "Reyes saved your life. I helped with the part the surgery couldn't reach." He looked at her with the direct, undecorated gaze of someone who had spent enough time in dangerous places to dispense with social hedging about important things. "The commander said you walked away from the work." "I took a break," she said. "And now I'm doing something different with the same skills." She looked at him. "How are you, actually? Not the answer you give people." He considered the question with the seriousness it deserved. "Tired," he said. "The kind of tired that takes longer to fix than the injury." He paused. "Better than I was." "That's the right direction." He nodded. He extended his hand and she shook it, and in the handshake was the specific acknowledgement of people who had been on opposite sides of a medical crisis and both come through. Different kinds of through, from different positions, but through. He walked toward the exit. She watched him go, shut bad. The last person to leave the hospital with any claim on the institutional identity that Hartwell Memorial had maintained for the previous 3 years was not Garrett Wolfe, who had been escorted out on the second morning. It was not Douglas Ferrer, who had submitted his retirement paperwork by mail. It was not Denise Hargrove, who had cleared her office on a Saturday when the hallways were quiet. It was Mara Donovan. On the afternoon she signed the final paperwork for her consulting role with the Trauma Education Program, the role that would bring her back to Hartwell Memorial periodically. Not as float staff, not as someone covering gaps, but as someone whose specific expertise the institution had formally acknowledged it needed and formally asked to be part of its future. She signed the paperwork in a conference room she'd never been in before, with Okafor across the table and a hospital administrator she didn't know. And when it was done, she walked out through the main lobby, past the information desk, past the security station, past the wide glass panels that looked out onto the access road where, 6 weeks ago, she had watched 3 helicopters descend below the mountain ridgeline. She stopped in the middle of the lobby and stood there for a moment, not because she was sentimental about the place. She wasn't, particularly, but because there was something she wanted to register consciously before she walked out. The distance between the woman who had walked across this same floor 6 weeks ago with her badge in her hand and her termination in her pocket, and the woman who was standing here now. Same lobby, same light. The mountain view through the glass was identical. She was not the same, not transformed, not fixed, not arrived at some final version of herself that wouldn't need revision. She still woke up at 3 in the morning sometimes with the specific quality of alertness that years of operational work had permanently installed in her nervous system. She still had conversations she needed to have with Holt about the 4 years between then and now that they had not yet fully had. She was still learning how to occupy the full dimensions of who she was without apologizing for the inconvenience. But she was not invisible anymore. She had not chosen to be visible. She had chosen to stop pretending that invisible was something she actually was. The distinction mattered. You couldn't shrink yourself small enough to fit the space that fear allocated for you. Not if you were genuinely yourself. It just meant you were uncomfortable all the time, and the people who needed what you carried went without it. She had known that for a long time. She had let herself know it, finally, when it cost her something to act on it. The lobby was busy around her. The afternoon shift change, visitors with flowers, a man on crutches, a nurse she didn't recognize walking fast with a tablet under her arm. The ordinary, continuous business of a place where people came when they were frightened and needed someone to know what to do. She looked at the nurse with the tablet. She thought, someone in that building is paying attention right now. Someone is watching a number on a monitor that everyone else is missing. Someone is standing in a room where the patient is trying to tell them something that the chart doesn't capture, and they're listening because that's what they do, because they cannot be in this work and do it any other way. Most of them will never be seen for it. Most of them will do it anyway. She walked out of the lobby and into the Colorado afternoon, into the light and the cold, clean air that came down off the mountains, and she let the door close behind her, and she kept walking. The woman nobody had respected had never needed their respect to know what she was worth. She had just needed, finally, to stop acting like she did.